Welcome to Concept in Medicine. Today we are going to be looking at the etiopathogenesis of sickle cell disease. Let's begin by first of all looking at the types of normal hemoglobin. You should know that there are three types of normal hemoglobin. What are they? We have the adult hemoglobin, which is written as HbA1. That would ring a bell when we are talking about diabetes mellitus, one of the diagnostic criteria by the WHO, HbA1c. It rings a bell, right? All right, let's move ahead. The adult hemoglobin, you should know that it constitutes about 95 to 98% of the hemoglobin in adults. Then, you should also know that the adult hemoglobin, that is HbA1, consists of or is made up of 2 alpha and 2 beta globin chains. 2 alpha and 2 beta globin chains. All right, let's move on to the next type. That is the HbA2, which is a variant of the normal adult hemoglobin, and it constitutes about 2 to 3% of the population of the hemoglobin in adults, and it is made up of 2 alpha and 2 delta globin chains. Then finally, the fetal hemoglobin. For the fetal hemoglobin, from the name fetus, it is more dominant in the fetuses. Up to the age of 6 months, you will have about 50 to 80% of the hemoglobin being made up of the fetal hemoglobin. That is in the children up to 6 months. For the fetal hemoglobin, it constitutes about 0.8 to 2% of the total hemoglobin in adults. And it is made up of 2 alpha and 2 gamma globin chains. Alright, once this thing has been put under the bed, we can then move ahead and look at the etiopathogenesis of sickle cell disease. Alright, let's move ahead. So you should first of all know that sickle cell disease is a single nucleotide polymorphism, that is a single point mutation occurring on the 6 codon of the beta globin chain at position 17. What does that tell you? It tells you that this single point mutation can only take place on the beta globin chain, not on any other globin chain. That is why sickle cell disease cannot happen in the HbA2 hemoglobin, neither can it happen in the fetal hemoglobin, because both of them lack the beta globin chain. So sickle cell disease is primarily restricted to the adult hemoglobin, that is the HbA1, because they contain the alpha and beta globin chain, and the mutation takes place on the beta globin chain. All right, let's move ahead. When the single point mutation takes place on the 6 codon of the beta chain at position 17, what is going to happen next? You will have adenine becoming substituted by thymine, and we should know that adenine and thymine, they are nitrogenous bases, where adenine belongs to the purines and thymine belongs to the pyrimidines. All right, let's move ahead. So in that case, we will illustrate. You should know that when we say a codon consists of 3 nitrogenous bases. 3 nitrogenous bases will give rise to 1 codon. So in that illustration, I have demonstrated here with an example, with the exception of the 6 codon where the reality is at stake. With those nitrogenous bases forming a codon is the reality, but the rest are just examples. So we have 1, 2, 3, 4, 5, 6 codons, and the positions are going to be made based on the nitrogenous bases. So if 3 nitrogenous bases makes up a codon, then we will have our 17th position in the 6th codon, which is here. So in that case, the GAG, the A in the GAG, where the A, which is adenine, is corresponding to the 17th position. So the GAG, where you have the A, which is adenine, corresponding to the 17th position, undergoes a mutation we call the point mutation, And in that case, what happened to the adenine? Adenine will become substituted by thymine, meaning that the mutation happens in such a way that the adenine becomes what? Replaced by thymine. And that will change the nature of the codon. So what are we going to have? We will have GAG becoming GTG on the DNA template. Alright, so when that happens, what is the next sequence? The GTG, which we are having here after the point mutation, is then transcribed on the RNA template. And you should bear in mind that that transcription would happen in such a way that the T in the GTG will be converted to U, because on an RNA template, there is no thymine. In place of thymine, what do you have? You have demethylation, giving you uracil. So in that case, the GTG, when transcribed onto an RNA template, will become GUG, which then is translated into an amino acid known as valine. So in that scenario, illustrating that, we are going to have glutamic acid, which is corresponding to the GAG, being substituted by valine, which is corresponding to GUG. So in that case, we are saying that GAG is glutamic acid and GUG is valine, meaning GAG codes for glutamic acid and GUG codes for valine. And we are saying that valine predisposes the hemoglobin to higher tendencies of polymerization, where they form polymers, where they clamp onto each other. As such, once it predisposes the hemoglobin to higher tendencies of polymerization, the red blood cells tends to lose their zeta potential. And what is a zeta potential? They refer to the degree of negative charges on the surface of the red blood cell. And as such, they tend to repel against each other, because lipoles repel whilst unlipoles attract. So in that case, with the like charges, the red blood cells are able to repel each other, preventing any clumping. But in this case, the red blood cells are losing their zeta potential as a result of the valine incorporating the high degree of polymerization. And as a result, once they lose their zeta potential, they tend to clamp onto each other and then adhere to the vessel walls, leading to vaso-occlusive crisis. And that is where the manifestations of sickle cell disease begins. Kindly make sure to subscribe, like, share, and also comment the next concept you would like to see in my next video. My name is Dr. Del, and this is Concepts in Medicine. Bye-bye.